muscle right here. I want you to try to turn that off for me, okay? Shut that down. Good. There you go. And I'm just going to take contact.
I heard that. Was it loud?
Yeah. Hi, Anastasia.
Hi.
Thanks for coming in today. Anastasia is the daughter of the owner of the personal training gym that I am currently renting out of Primal Athletics. If you follow the channel, you should know that that's where I'm based. And we've all been eagerly waiting her to come home. She had just left Oakville to go to Quebec McGill University, Montreal. For her first year of undergrad. So yeah, she's back now. She's been walking a lot more lately and is feeling a lot of like kind of bodily complaints. She works out a lot. So I'm expecting that's what we're going to be dealing with. But Anastasia, why don't I let you talk about you rather than me just go on.
So I'm a student at McGill, and I feel like the biggest complaint for me right now is like my upper back has been hurting. I think from just wearing my backpack or just like walking a lot, that has been like pretty bad. And then since I've been back and I'm still walking like probably even more, it's just been even worse. So I wanted to kind of focus on that.
Yeah, so if you don't live in Oakville, if you need to get anywhere, you either need to have a license, which Anastasia, you do not have a license, or you're going to be walking a lot. Yeah. So we talked about step count off camera, and she's actually jumped from, I think, an average of like 10 to 20.
Yeah, I love walking, but like it's definitely been a lot more.
It's been a lot of walking.
Yeah.
So combine that with the weight training that she does regularly, and you could expect some bodily soreness. And then again, if she's a student, she's getting upper trap tightness. That's probably from hunching over her desk and studying for long hours, which I assume you study. For some of the time that you're up there. Which we can very easily take care of as well.
Okay, perfect.
So for today, what we're probably going to be doing, we're doing this history right now. We'll be doing a physical exam, and then we can get into the treatment. Okay, does that sound good? Perfect. Yeah. All right, let's get started. All right, so Anastasia, you were mentioning that you do have a lot of stiffness up here in the traps.
Yes.
Okay, now the trap muscles, if you watch the channel, you'll probably know this, extend actually to the very top of our neck, out to our shoulders, and then down into the center of our back in like a diamond-like shape. So we're going to check out your neck today as well as your upper back, okay? Okay. So to start, I'm actually just going to get this hair out of the way. Sorry about that. Sorry. Flip it over that shoulder. And I'll get you to bring your chin down to your chest for me, okay? And that's okay. Is any stiffness or tightness being provoked back here?
I don't think so.
No? Okay, now if I go ahead and press further.
It's definitely like stiff.
That's worse?
Yeah.
Okay, so you're feeling some stiff from there. You can come back up. I want you to look up to the ceiling for me, okay? That's okay?
Yeah, that's fine.
All right, perfect. I'll get you to check your blind... You wouldn't know what check the blind spot means. I'll get you to rotate your head this way. That was mean. I'm sorry. Is that as far as you can go?
No, I can go
perfect.
further.
Full 90. Okay, now let's go this way. A little bit decreased on this side. You're about 80 degrees, whereas here you're at 90. Interesting. Okay. I'll get you to look forward, ear, down to your shoulder for me. Good. That's okay?
Yeah. Okay. It feels tight, but it's...
Feels tight?
Yeah.
On the left side or the right side when I do that? On the left side.
Yeah, left side.
I'll get you to tilt to the left, and we'll do the same thing. How's that?
That feels tight too.
That feels tight too. So one thing I'm noticing with Anastasia here is that it's not all traps involved. She has quite prominent scalene musculature as well, which connects from the top of the C-spine here down into the first rib. So we'd probably be working on that later as well. All right, so my hands are going on your back now, okay?
Okay.
All right. Always important to say that because I don't want to startle the patient when I just go in there, so, you know. So Anastasia was mentioning off camera just how much coffee she's been drinking as an undergrad lately. How many cups, or how many, I can't even say cups because it's not just coffee, have you been having at McGill?
Every morning, like almost every morning I'd have like a large shaken espresso which has like 4 shots of espresso in it. And then I was relying on a lot of energy drinks because they were all in the vending machines all around campus, which uses the meal plan too. So
because you said Starbucks is on your meal plan,
yeah,
right?
Starbucks on my meal plan. The vending machines I could just get
McGill knows their student body if they're giving Starbucks on the meal plan.
Every dining hall has like a bunch of coffee machines.
Oh my gosh,
it was bad.
When I was in my doctorate, so not my undergrad but afterwards, during some exam seasons, I was regularly having like 6, 7, 8 cups of coffee. Yeah. And the rule in the house was if you're making coffee, you make a full pot, because all of the boys, all of the roommates, we were all doing it. But I actually drank myself to a stomach ulcer. So just be careful with that, you know. Don't 4 is a lot, but I say don't go over 4, okay, like that.
Yeah, I think they say like 400.
400 milligrams
Yeah.
caffeine? Yeah,
That's
well,
like the
obviously not
limit.
400 grams, or I think you'd
No.
probably be dead. Yeah, I don't know what the lethal dose of caffeine is. Are you right or left-handed, Anastasia?
I'm right-handed.
Right-handed? Okay. It's interesting to feel that you feel pretty tight on both sides for the traps there. Okay. Let's move down. And we're going to go into the lower back now as well. So, bottom of your spine is your sacrum.
Yeah.
Okay. Just off your sacrum are your hip bones or your iliacus or your iliums, whatever you want to call them.
Okay.
The joint between is the SI joint. It's right around here. Okay. Are you okay if I palpate the SI joint? Perfect. Okay. So, left, right. You're feeling stiffer on the left today. Which, was that the hip that was bothering you?
Yeah, that's the one that's hurting.
That's the one that was hurting you the other day, okay. Okay. Just hands going on the front and relax. Good. That okay?
Yeah, it's good.
Okay. Hands go on the front and relax. Good. So I'm kind of getting ahead of myself right here. I'm doing some low back treatment just because I know what we've done with Anastasia in the past. But to any guys who are watching the channel right now, if they have like a girlfriend or a fiance or wife or something, this movement that I just did right here, I'm going to show you how to make sure they're very happy. If you hold the front of their hip, pin that down with the other side and kind of distract in this movement, that's a movement that nobody ever feels ever. And I've yet to meet a single patient that dislikes this. Everybody will come here almost for this. It's called an iliomammillary mobilization because the structure on the lumbar spine we're contacting is called the mammillary process. Don't ask me why, that's just what it's named. But if you do that, you're definitely going to be making sure that they're quite happy because that's going to relieve a lot of lower back tension. You're welcome.
Thank you.
All right, so low back's kind of handled, left SI, we got tightness in both the traps, yep. Next thing is I'm actually going to get you to flip onto your back for me, okay?
Okay.
Go ahead. Anastasia, neck palpation, and also probably SMT, so I'm just going to get you to lift your head up for me. Thank you. I'm going to move your hair out of the way there and lower the head. I got you. Perfect. Okay. So, I'm just going to start by feeling around and seeing what we see, or feeling what we feel, rather. So one downside to a chiro channel is that patients aren't able to feel what I feel. But so Anastasia is not particularly restricted at the very top, which is very common in a lot of students, the CO, C1 level. When we drop down C1, C2 abouts, that's where I kind of feel a bit of a restriction or a muscle knot. So we're going to go ahead and do some MRT or myofascial release with that. So is that okay, or is that too much for you,
No,
Anastasia?
it's
That's
okay.
good? Okay. Ooh, loud weights. Once again, in a gym.
Yeah.
So what is your favorite ice cream flavor, considering you're working on marble slab then?
Favorite ice cream? My favorite ice cream flavor has probably always been mint chip.
Mint
But-
chip.
I know, I get a lot
I don't
of
feel
hate for
comfortable.
that.
I don't
I
feel
get a lot of hate
comfortable.
for that.
I don't feel comfortable treating you anymore. Like that's.
But like when I'm doing the ice cream marble slab, the red velvet looks so good. I want to try it.
Have you snuck any ice cream?
No,
Lunch
because like they don't have sample spoons.
What?
They don't have them, so I have to say no when people ask for samples.
That's so
and stuff.
unfortunate.
I
Bring
know.
your own sample spoon. It can just be a regular sized spoon.
Yeah, exactly. But I think I don't know. Not yet. It was my first day.
Yeah, maybe
You'll
wait
wait a
till
bit.
maybe wait till week 2
Yeah.
before you
Then
start
I'll take
causing
the
that
red
kind of
velvet.
stuff. Yeah. All right, so I think we'll go ahead and adjust it. Now, Anastasia has never had her neck adjusted before. We've talked about it off camera. She's comfortable proceeding, of course. But it's always a little bit nerve-wracking the first time. You nervous a little bit?
A little bit.
Don't be stressed about this. I've had other videos with people getting adjusted for their very first time, and they always have a good response to it or a good experience, okay? So in order to do this, what I need you to do is I'm going to get you to turn your head as far as you can to the left for me, okay? Good. And then I want you to just drop, and you feel this muscle right here. I want you to try to turn that off for me, okay? Shut that down. Good. There you go. And I'm just going to take contact.
I heard that. Was it loud?
Yeah. Yeah, so it's very loud to the patient because it's literally inside of them.
Yeah.
So they can hear it both like with their ears as well as like
Okay, I
inside
didn't know
of
if it was
them.
because it like
How was
sounded
that?
really loud.
Yeah,
It was okay. I thought it was maybe like.
Oh, no.
I didn't know it was happening right away. It felt fine.
Exactly. You got to sneak in before the defenses come up. But that was, I'd say, like to me, that was maybe like a moderate volume. But hey, you had a good release. That was perfect. No worries. And most importantly, it wasn't scary. Well, actually, most importantly, it feels like it's released. That's probably the most important thing. All right, now we got to look to the other side. So to do that, I actually have to move the microphone real quick, and let me do the massage first, okay? We want to warm the muscles up or loosen them up before we just go in there. Are you not? Sorry, one moment. We'll put that. Yeah, this is an example of when I fade out and fade back in. All right, good. So, perfect. So yeah, in the chiro community, things like if I were to just go in and adjust your left side right now, we'd refer to that as a quote-unquote cold adjustment because you didn't warm the muscles up, right? And like those can be kind of uncomfortable or painful, and they don't always go as well. So I always practice quote-unquote warm adjustments where we try to massage things out and get the other tissues relaxed first before we go for the deeper joint levels. And a lot of people seem to respond better to it, so that's just my personal choice is to do warm versus cold. Feels a little bit knotted, eh? What's that? That's painful, eh? Okay, I'll go a little bit lighter on it. Now, a little bit lower down on the left side versus the right side. We're going to go ahead for that. I'm going to get you to turn your head as far as you can to the right. Good. Turn this muscle off here. I want you to try to relax that. Good. And that's it. Very good. You were so calm on both sides. Good job, Anastasia. And just a little bit of long axis distraction. I don't know a single person who doesn't enjoy having their head pulled on. That's not a joke. It sounds funny, but like it's also true. Does this feel kind of relaxing for you?
Yeah, it kind of does.
Yeah. Good. Okay. Yeah, so you got the arm position right on this side. Perfect. And the leg position. You're a fast learner. You are a student. You're a fast learner. I need you to scoop the hips towards. Thank you. And relax that. Good. And take a big breath in, please. And all the way out, all the way out. Very good.
Perfect.
All right, so just feeling through once again. What was the workout today, by the way?
It was full body.
Full body workout, okay. As long as it wasn't back and all these are like really hypertonic now, because that would be a little bit...
It actually wasn't that much. There was some shoulders, but I don't know if there was back.
Good. Very good. Breath in. All the way out. Okay. Now, so as a heads up with this, actually, you know what? I should literally ask you this before I get started. You'll get redness as a result of this? So, like, do you have any, like, hot dates or family dinners or anything coming up where, like, you're wearing something, like, showing the shoulders or no?
No, it's all good.
No? Okay, just give me the heads up. All right, so, coming in. Okay, so. Now, it's around this time of the filming treatments, Anastasia, where I ask patients a question to try to engage them a little bit. Now, you just moved away to McGill for a year, which is a super exciting time in any student's life when they go away to post-secondary and move out of the house for the first time. Do you have a favorite memory from your time? And is it okay to share on camera?
Yeah.
Okay.
I think my favorite memory was like the first week of school.
Okay.
When I didn't really know everyone on my floor because I lived in the dorm.
Mm.
And me and a few other people, we all like made brownies, and then like we had like on our floor in the hallway, like our whole floor went to like eat brownies, and we like met everybody, and that was probably like my favorite memory.
That's actually really cute.
I know, it was really cute. And then I like met everyone that I lived with, and that was like the first time that we all like were together.
Love made,
really
love made over the baking pan, eh?
Yes. I remember we were making the brownies, we almost like forgot about them in the oven in the kitchenette.
Nice.
Which would have meant like 300 people had to go outside of the building for like a fire.
Oh, if you actually like
if we
burned
actually
them?
burned them.
That would have been a great first impression. Hi, my name's Anastasia. I caused a fire drill.
I
Like,
tried making brownies, but yeah, instead you have to leave your room.
that's a very cute favorite memory, I must say.
No, that was really cute. It was like right at the beginning.
Get a little bit more of this stuff. Give me a second. Switching to the other one. And then I'll also ask then, you're in school to be a teacher. Why is it that you want to be a teacher? Actually, was filming a teacher doing this literally the other day, so I'm just kind of curious. Yeah, it seems like almost full circle. I'm looking into the future here. But what was it that first drew you to teaching?
I feel like I've always like wanted to be a teacher. Like I remember that was always like the career I'd pick whenever I had like a project. I was like, oh, like what do you want to do? And I feel like for me, like I love like I don't know, like I feel like I just love like working with kids and like volunteering with all of like at summer camp and stuff, and I feel like it's just like the best job that like I can study like for me. And then like I feel like it's just a better like lifestyle because I'll be done earlier in the day and like
well, if you ever do have children yourself, then yeah, it would sync right up with their schedule, right? So I don't know if that's on your radar at all, but
no,
like still it does
sure.
It does kind of sync up with that nicely. So you're that kid who kind of had a dream and it didn't change, because I swear I wanted to be like a fireman and then I wanted to be a paramedic.
No, I've stuck with teaching.
Yeah.
I've
Ever since day
had it,
one.
yes.
Yeah. didn't want to be a police. I want to be all the 911 things, and then realize that that's way too stressful. So yeah. Mm-hmm. No, but that's good. You kind of, at least you're consistent. We'll give you that, right? And I mean, even here, you were helping to teach a client of Primal's English just in your free time. Because how did that go, by the way? That was okay?
Yeah, I think it went well. At the beginning, I was like, I never done it before, but I think it went well.
Well, hey, you're trying and you're learning and you're getting hands-on experience. So you're doing everything right, in my opinion, right now, Anastasia, which is good.
Thank you.
Not that you were asking for my opinion, but still, there you go. You have it.
That's good.
I offer it for free to anybody who doesn't ask.
Perfect.
That feels a little bit messy up there.
Really?
Yeah. Well, how do you feel when it feels that right there? Did you catch that?
It hurts.
Yeah. Okay. If it's too much, I'll back off.
No, it's okay.
Okay. I always joke with my patients because what I do is technically referred to as like sports massage, right? Not your traditional massage. That the difference between sports massage and traditional massage is that traditional massage feels good. Sports massage doesn't. Okay. More in there to target specific structures and get them to loosen up versus making you feel good for relaxation purposes. But hey, people sometimes still fall asleep while I do this, and I don't fully understand
I don't get that either.
Yeah. Yeah, even the last video that I did, a woman was saying that she was ready to fall asleep by the end of this. I was like, oh, okay, sure, thanks. It's a compliment, right?
Not during it, though.
Mm-hmm.
The
Maybe not during, the after effect. That's what we're here for. So, speaking of which, I think we are mostly done with this for now. So, yeah. So just so the camera, I always got to talk to the audience here. We got some petechiae here, which is that redness that you're all familiar with, and then we also have just generic throughout. So again, blood flow, fascial adhesions. Okay, you guys are all probably pretty familiar with that by now. So just sit back. All right. So to the channel, I don't like to use the massage gun directly on skin. Because number one, it can be uncomfortable for the patient. Number two, after we've done the instrument-assisted soft tissue therapy and we've used that emollient or lubricant on the back there, that can be damaging to the head of the massage gun. So it's always good for them. Have the patient put back on their shirt, their sweater, whatever they got, and then you can go ahead with the local vibration therapy. That's the same ticklish spot, Yeah. People have a bunch of different reactions to this. Most of them find it relaxing, but occasionally they'll find one spot that's either very tender or ticklish. Some people say it makes their nose itch. Like
I feel it in my throat.
You feel it in your throat? There. That's weird considering I'm on your track. But okay. We'll back on. They both start with T? I don't know. That might be it. Alright, we'll come down to the lower back. Last thing we're going to do is I'm going to get you to sit up in one. So to start, what I'm going to do is I'm actually going to get you to look up and to the right for me. Up and to the right, good. And I'm going to take my pointy elbow and I'm going to put it right, oh man, this is going to be fun. I'm going to put it right there, and I want you to slowly look down into the left for me, okay?
Okay.
Go ahead. You can go a smidgen faster than that. Good on you for listening, though. That's very good. Awesome. Okay, we're going to do that 5 more times. Up and to the right, and down into the left. Oh, it's a sports bra strap. That's why that felt so knotted. Okay, good. That's a little bit reassuring, actually.
Yeah.
Good. Awesome. Okay. Different movement now. I'm going to get you to tilt this ear down to this shoulder. Good. I'm going to come in, and you're going to tilt your left ear to your left shoulder. So for those watching this technique, the first one targets the levator scapula, connects the scapula or our shoulder blade up into our neck. This second movement, tilt right, targets the upper trapezius fiber, as you can tilt left, which I mentioned way back at the start of the video, I do believe. Good. 2, and tilt right, and tilt left. Ooh, that okay? You're surviving?
Surviving.
Okay, good. This doesn't always feel good, but the after effects are really what we're after here. And tilt. 4, 2 more. Awesome, 1 more. Good. Last one on this side. Oh, Anastasia, you crushed it.
Perfect.
Good job. Now we're going to do the other side, okay?
Okay.
So you need to look up. Yeah, well, actually, first we're going to move the hair again.
Yeah.
You go ahead. You can move it. You're better at that than I am. Good. All right, we're going to get you to look up and to the left. Good. And we're going to look down and to the right. Okay, go ahead.
Okay.
Good. Up and to the left. Down and to the right. Up and to the left. Down and to the right. Good. 3 more. Which side felt worse?
My right
Your
side.
right?
Yeah, that felt worse.
I'm going to get you to now tilt your left ear to your left shoulder.
Okay.
And we're going to tilt right to right. Go ahead. Good. Oof. Good. 3. I think that's 3.
Yeah.
Good. 4. I'm glad one of us can count. It's actually embarrassing how bad I am at counting these. 5.
I was like about to do an extra one.
6. No, Anastasia, no. She's like, I'm counting the 6. I am not doing 7. Not a chance. Congratulations, you made it through the MO. How was that, Anastasia?
It was good. It was actually, yeah, I like the whole, like, when you, like, crack, like, my spine. I feel like that was, I feel, like, looser now.
Okay, that's good. You feel more or less restricted, more mobile following, and that's, especially after a workout, you're either going to be loosened up from that, or if it was a particularly intense one, you might be sore right afterwards, so I hope that was beneficial.
And that was the first I've ever got, like, my back and stuff, like, adjusted.
Yeah, so no, in the past we've really been working on her lower back, but today we were able to explore a little bit more, so I'm happy you had a good impression.
Yeah.
How did you find the tools, the sports massage? That was your first time getting any of that?
That was my first time, yeah. They were good, but after a while, like, it gets a little
painful,
sore,
right?
Yeah, but that's probably, like, a good thing.
That
it's
is
just, like, doing something.
Exactly, and that's not an unusual thing to hear. Again, I think I even joked about it in this video that the difference between normal massage and sports massage is that sports massage can be a little bit painful, but it gets the job done, at least in what I've seen, what my patients see, way better than to just a relaxation massage, which, don't get me wrong, there's definitely a place for that. Stress does manifest in our body. Relaxation massage targets the stress more than the physical ailments. But no, when you're in here, we're trying to get a job done. You can't make an omelet without breaking some eggs. So at least that's my motto. But anyways, thanks again for coming in. It's really appreciated. Happy you're back from your first year.
I'm happy you're back too.
Good, and I hope you have a great rest of your weekend.
Thank you, you
thanks.
too.
High five to Ed.
Don't forget to like and subscribe.
Thank you, Anastasia.